So this video is for brow and lip wax, and we're going to actually start as we would arrive to work. So we're going to wash our hands when we get there. So we are going to wet our hands, and we're going to find a coin-sized liquid hand soap, and we are going to wash our hands down to the wrist. We're going to wash the back of our hands down to the wrist. We're going to wash our fingers. We're going to wash the backs of our fingers, fingertips, and nails. We're going to wash between our fingers. We're going to wash between our fingers and our thumbs. We're going to wash our thumbs and our wrists. And we're going to do all of that for a minimum of 20 to 30 seconds. And then we're going to thoroughly rinse underneath the water. When we have done that, we'll find disposable paper towels, and we will turn off the faucet with the paper towels, dry everything thoroughly, throw it away, and when we have done that, we will get our 70% ethyl alcohol hand sanitizer, and we're going to go ahead and sanitize. And then we need to get our room set up and ready for our client, and our first client today is a brow and lip wax. So, excuse me. To prepare our workstation, we need to disinfect the workstation, bed, and equipment using a disinfectant wipe and following manufacturer's instructions. We'll check equipment to ensure that all devices are in safe working order and plugged in to a working receptacle. We'll gather clean supplies needed for the facial service. Storing in a clean, closed container, we'll dispense products needed for the service. We will prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or remove the product with a disinfected or clean single-use spatula. Close the lid to the product and set the portion cup tray on the tray. We'll place disposable table paper on the disinfected bed to ensure that wax does not fall onto the bed. So just to let you know, my tray is set up over here, and I've got everything ready to go. So we'll talk about what we have. We have some pre-epilation or antiseptic right here, cotton rounds, gauze squares, wax sticks in different sizes, powder, wax, which obviously would be in a wax pot, post-epilation, and then soothe. So we have wax strips, Q-tips in case we need, disposable gloves because we will be always wearing gloves for this service, and we have tweezers, and then I have my scissors for if I need to cut any more wax strips. So we're ready to go on that. What you need to do now is actually meet and greet your client to find out if it's appropriate for them to even have the service. So let's talk about that on our client consultation. Of course, when you go meet with your client, no matter what, 100% of the time, you're going to go with clean hands. So I will be washing my hands again before service, but just so you know, you always go with clean hands. So we're going to greet our client and escort them to the work area. We will assess the client's current style. We will determine the client's preferences. We will assess the client's needs. We will assess the client's skin by performing a visual skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. We'll assess the client's consultation form for any medications and products used within the last 72 hours. We will consult on any known allergies. We will consult with the client on any facial surgeries within the last 3 months, and if the client is under a physician's care, we'll assess if the client is prone to cold sores or fever blisters. We will assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. We will assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. And if the client is free from any of those contraindications, you can move forward with the service or procedure. And our girl is, so we are going to be able to move forward. And what we need to do is get her comfortable. So she doesn't need to disrobe. We just want to get her down and comfortable. We're going to put a towel under her neck for additional support. We're going to put a headband on to keep her hair away from any wax around her brows, etc. And then we have this additional towel that I want to cover her up with because I don't want her to have any opportunity that wax might get on her or her clothing. And so what I am going to do now is wash my hands. So I am going to wet my hands at the sink and then find that coin size amount of liquid hand soap, washing down to the wrists. I'm washing the back of my wrists. I'm washing my fingers and the backs of my fingers. I'm going to wash my fingertips and my nails. I'm going to wash between my fingers and my thumbs. I'm going to wash my thumbs. And we're going to do all of that for a minimum of 20 to 30 seconds. And then thoroughly rinse them under the sink. When they're rinsed, you're going to grab your disposable paper towels and turn the faucet off. Dry everything completely. Toss the paper towels in the trash. And reach for and find your hand sanitizer with that 70% ethyl alcohol to sanitize. And before you put your gloves on, just make sure your hands are really dry, or it is difficult to do. And so I'm going to go ahead and go in and analyze her skin and do a couple things, but I'm not going to put any wax on her until I test the wax on myself first, of course. But I do want to go in and go ahead and do the assess the hair growth on her brow area where we talked about where she wants to have it removed, and just kind of see what we're looking at. And then I'm going to go ahead and do that pre-epilation step right now. I'm going to remove everything I can from the area. And figuring out, obviously, which way the hair is growing and then how I'm going to be removing that hair. And then I'm going to be following up with powder because I need the area super dry, super dry. No moisture whatsoever. test the wax on myself first. And that feels good. It doesn't feel too hot at all. So that is a perfect start. So I know that it's safe to go in and start her eyebrow wax. So I'm going to be applying the wax in the direction of the hair growth. Doing the same thing when I remove it in the direction. So I will be doing 2 different ways to remove it. So you want to get it nice and soaked through, and then you hold the skin nice and tight and you remove in the opposite direction and then press on the skin. Because you can't go back another time. There's a few things I'm going to need to tweeze, but that's okay. It's pretty good. So I'm going to go on top of the brow. Applying in the direction of the hair growth. Skin nice and tight. Press. I'm just going to use a little bit of remove, not post-depilation, but remove to get the wax off. Excess wax, and then I'm going to go in there and tweeze any little hairs that are left. That's pretty good. So I'm going to move on to my other brow. Just removing any excess wax. Grabbing my tweezers to remove any hair that needs it, and then I have my round here with me to just put them on, and I'm also removing the hair in the direction of the hair growth. And now we have the center of the brow that we have to do. That hair grows down, so it's going to be a little bit different. Anywhere's fine. Have fun. And we're going to lift up because that's the opposite direction, so pull the skin nice and tight and press. So we're going to remove any excess wax also. And I only have a few little things to tweeze here. So really only on this inner corner of the brow. And really they look outstanding. So what I want to do right now is give her a little soothe, calm everything down. A little soothing step before we move on to the lip. Same thing down here. Obviously, if it was a different client, I would be retesting the wax on the temperature on myself, but I won't need to because it's the same client. But what I'm going to do first is figure out the direction of the hair growth, and what it looks like is I have a little out and a little down, and in the middle also a little bit of down. So that's what I'm going to concentrate on is that way. And I want to prep the area first. So what I'm going to do is do my, first is my pre-epilation step. Make sure I remove any makeup, oils, moisturizers from the lip area. course, a little powder. And it's really nice and matte, which means it's going to be good now for the wax. Start on this side, and once again I'm going to be applying my wax out and down. And remember, no need to test, it's the same client. Temperature, that is. Hold the skin tight, remove away from the growth of the hair, press. And I say this on a lot of the videos, but it's so true, this area is not a comfortable area to do. It's one of the reasons why I try to get through it as much as possible, quickly as possible, hold it tight, pull up, and press, because it really is painful. I don't feel like it ever gets any less painful, but maybe it does. I'm gonna go to the other side. I'm gonna treat this as one area like I did each individual brow, but I'll tweeze at the very end. Nice and tight, and remove. Pull it nice and tight and remove. We have one more area that we need to get at, which is the inside of the lip. And that hair is growing kind of like forward and down. It's a little bit harder to get to. Try to get all the way up to the nose. There we go. I only want to do it once, so I wanted to get the last strip that was the right size. And I'm going to hold the lip skin nice and tight, and I'm going to pull up, kind of up and out. You can't go straight up because it's the nose, but press. And then let's take a minute here to remove any excess wax before we tweeze. tweezers and finish up the task. And now it's time to soothe that area. And I'm just going to grab something real quick. And I'm presenting to my client to show her how amazing she looks, and she loves it. So, she's thrilled with the results, so am I. We're going to get her unwrapped here, and I will be taking off my disposable gloves and discarding them, and then basically what you do at this point is you are going to discuss follow-up, any kind of maintenance or aftercare she might need, get her booked for her next appointments, recommending how often you think she should come in, and then you need to get back to your room because you have another client coming, so let's talk about how you would finish your service. So you're going to get all your implements and you're going to put them in a closed container labeled to be disinfected. All of your linen here, etc., you're going to be putting it in a closed laundry basket until it's time to launder. You will discard any single-use items in the trash, like your little wax strips, anything that you had in disposable cups, etc. You're going to get rid of that. Then you're going to locate a disinfectant, not disinfectant, but you're going to locate a cleanser, and you're going to read the manufacturer's directions, and you will follow the manufacturer's directions to wipe down your area, removing any debris. Then you're going to locate a disinfectant that is bactericidal, virucidal, fungicidal, EPA approved for use in a salon setting. You're going to follow those manufacturer's directions, which means you're going to need to put gloves back on. You're going to put a new set of disposable gloves on, follow the manufacturer's directions for mixing and or usage, or you can use an aerosol disinfectant. And then if you have any equipment that needs to be disinfected, you will do that, and then store it in an area away from anything dirty. Once you've done all of that, you will wash your hands one final time. So you're going to rinse your hands under the sink. You're going to get a coin-size amount of liquid hand soap. Rub your hands together down to the wrists. Rub the back of your hands together down to the wrists. You're going to rub your fingers. Wash your fingers. You're going to wash the backs of your fingers. You're going to wash those fingertips and nails. You're going to wash between your fingers. You're going to wash between your fingers and your thumbs. You're going to wash your we already said that, fingertips. You're going to wash your thumbs, and you're going to wash your wrists. You're going to do all of that for a minimum of 20 to 30 seconds. Then you're thoroughly going to rinse your hands under the water. When you feel like you've had that proper hand wash, rinse, you're going to grab disposable paper towels, turn the faucet off, dry everything thoroughly, toss that in the trash, and then get your 70% ethyl alcohol hand sanitizer. Rub your hands together, get everything fully sanitized, and you will be ready to set up for your next client, which is also a great milestone of video end for brow and lip wax.